Welcome, everybody. I'm really excited to be here with you today, and I'm hoping that we get a few more people to join us, but I'm excited to have this conversation with everybody. I want to start by thanking you all for making time to come to today's webinar and to be part of this important discussion, and mostly for your commitment for implementation science research, especially within your CCBHC programming. So my name is Michelle Zabel. I'm the Executive Director of Innovations Institute at the University of Connecticut School of Social Work. We're a translational research and implementation science center, and we work on behalf of improving outcomes for people who need to access public systems. So we're a proud member of the CCBHC TA Center, and looking forward to hosting this series. For those of you who went to the kickoff webinar, you know, and you've been tracking, hopefully, the communications about the EBP Implementation Science Pilot Project, you know that the purpose of this learning community is to provide space for CCBHC grantees to really dig in and establish a strong foundation in preparation of partnering with researchers and going through this project. You gave us feedback. Today is really about implementation frameworks and developing research partnerships. And you know, as we go through this series, particularly the top topics that were just presented to you, you'll see as our major topics for the next 5 months together. In each one, we're trying to take a moment and really talk about it from the perspective of how do you use that information to engage with the researcher and prepare yourself to really have a great partnership with them as well. So the learning objectives for today are on the screen, but this is an opportunity for us to kind of baseline our understanding, which was asked for in the surveying and the evaluation around implementation science, give some field-focused examples of how organizations have used that implementation science framework to partner with researchers and move forward. And I'm just really thrilled that the folks that came together today, I know. So we've got a really solid team of people that have been working together for a number of years. The first one is Angela Weeks. She's the director of our National SOGI Center at Innovations Institute, and she has an extensive national experience creating, implementing, and evaluating programs and initiatives that improve the lives of LGBTQ plus people and communities. And she's led a number of initiatives grounded in implementation science. Dr. Marlene Matarese is here as well. I should have said Dr. Angela Weeks, so forgive me. Dr. Marlene Matarese is here as well. She has 20 years of experience at the individual county, state, and national levels. She's an associate research professor at UConn School of Social Work, and she's the deputy director at Innovations. And she really specializes in content that's focused on evidence-based and evidence-informed intervention design, best practices with implementation science within the context of public, child, youth, and family systems, as well as LGBTQ plus sexual orientation, gender identity, and gender expression. She works a lot in workforce development and systems of care. And what she didn't put in her little bio that I'm reading from right now is that she's also a brand new Fulbright. So next fall, she'll be going to Ireland to be expanding her work to international as well. And then I am really excited that Jessie Follenkamp has agreed to be with us as well. Jessie is an LGBTQ plus parent and social worker with 20 years of experience working in community facing systematic oppression. She's the educational and evaluation director at the Ruth Ellis Center in Detroit, Michigan. And her work really focuses on safety with LGBTQ young people, no matter where they go for care. Jessie's been the lead, so she's like your person. She's been the lead of several initiatives at Ruth Ellis in the state of Michigan that used implementation science frameworks to guide their work. And as part of that effort, she's partnered with two different research partners to evaluate initiatives and implementation of the work. So she's got some really very practical experience. So I'm going to turn it over to you guys, and I'll be back at the end to help answer questions. Please, throughout this whole presentation, feel free to drop all your questions or comments. We, again, will be monitoring and feeding people, feeding our presenters, as well as coming back at the very end and feeding questions as well. Okay, thanks.
Thank you, Michelle. Some of you may be wondering why we're all connected around LGBTQ populations. It's because we just got done finishing a rather large federal project that used implementation science to help develop and implement and evaluate over 15 programs and initiatives in child welfare settings. So just coming off that project, having worked together, it was pretty easy for us to all come up with today's agenda and the content that you'll be getting today. So thanks for being here. And I'll just be going over the first half of this presentation around frameworks and what are some common themes within frameworks that we'll talk about. So next slide, please. I'm going to start with the definition of implementation science. So implementation science is the scientific study of methods to promote the systematic uptake of research findings into practice and to improve the quality and effectiveness of services. So you can check out the link that's there's links throughout the presentation you can click on for more information for all the frameworks we'll be talking about today. But essentially, I think of implementation science as the study of what is going to make the most effective implementation efforts. So that's whether you're doing an initiative or a program or you're looking at culture change. And so as implementation science has progressed, people find out new information, they find new ways to describe things. And because of that, multiple frameworks exist. The field is always trying to do better at trying to explain all of the dynamics that implementation and evaluation brings, especially in settings like this one where you're serving populations in need. And so we'll talk about a lot of frameworks today, and I hope that it's helpful in demonstrating just how much is out there and how much progress has been made and how much thinking has really gone into this field. So a framework, we'll talk a lot about implementation frameworks. Essentially what it is a roadmap or a checklist to help you guide your implementation process. So though on their face, they seem really complicated, they are there to help. Sometimes they seem complicated because there's multiple frameworks being used together. And so I'll show you some examples of that and we'll talk about it. But essentially there are three types of frameworks. There's frameworks that describe an implementation process. So what are the different phases of implementation I have to go through? How should, what are sort of the activities in one phase versus the other? Then there's frameworks that identify benchmarks of implementation, so how to do it, and then evaluating implementation. So let me get a little bit more specific on the next slide. So this, I find this to be a really helpful diagram. So if you look at the second line, you have three buckets. So the first one is describing or guiding the process of translating research into practice. These are usually called process models or process frameworks. So these would be things like the different phases or stages of implementation. And I'll show you some examples of that in a bit. And then the second group of them are understanding or explaining what influences implementation outcomes. So you'll hear me talk a lot about determinant frameworks, and that are just simply, it's the things that determine success or challenges in your implementation efforts. So keep that phrase in mind, determinant frameworks, because I will mention that a lot today. And then also in this bucket of sort of understanding what influences outcomes are your classic theories and implementation theories, which you might not be aware of, but are actually a lot, it's a big part of our conversations and a big part of the work that you'll be doing with your research partners and also sort of infused throughout your frameworks. And then the third bucket is evaluating implementation. And these are your evaluation frameworks that help guide evaluation over the course of your project. So next slide. I won't go over all of these definitions, but I did want to provide them here for you so that you could look through them. I think when I realized early on in my implementation work that there were multiple kinds of frameworks, it was sort of this aha moment for me because I was really confused about all the frameworks that were out in the world, which one to choose and how do they all fit together and why do some people use 3 frameworks at once. And it's because that there are frameworks that are developed for certain settings. There are frameworks that are developed for certain purposes. And so having an understanding of where it all fits is helpful in determining what you need to be able to do your work well. Next slide. And then the types of frameworks you use, you know, I'm going to show you a bunch today and you don't have to choose any of these if they don't feel right. I think you would really probably determine the frameworks you're going to use once you have a research partner. But I think some things that go into thinking which one is a good fit for your work is determining your needs, understanding where the particular framework has been used in the past, because some settings have frameworks that are rather popular. So mental health, child welfare, I'll show you some of the popular frameworks that are in those settings. But you can look at settings, you can look at previous studies to see how folks implemented them and what were their experiences. And I also think that selecting a framework is also about your own understanding of it. If you look at it and it feels overwhelming and you don't understand it, it may be that you should explore another option. Because one of the things that's really important is that you're able to describe it to others and that you understand it in a way where you can guide the other folks around you, your team members, your workforce, and understanding the work that you're doing too. So sometimes people get sort of, they select a framework that they don't quite understand and then they feel overwhelmed by it. They may give up on it. And so I think that understanding is really important into selecting and then landing on a framework that works for you. And so once you identify a research partner, they may already use a framework and can sort of help guide that process as well. But I think that understanding is a really important piece. Next slide. So here's some common framework examples. Next slide. This is a diagram of RE-AIM. You may have heard of it. RE-AIM is a framework that's really been used to help plan for implementation and evaluation efforts. So there's different categories here to think through with these questions that are rather large, but it is helpful in grounding your planning and your evaluation. So how do I reach the target population? How do I know my intervention is effective? How do I develop the institutional support to deliver my intervention? How do I ensure the intervention is delivered properly? And how do I incorporate the intervention so it's delivered over the long term? Next slide. Another one that you might see is the practical, robust implementation and sustainability model. This graphic here is actually a logic model that shows PRISM and RE-AIM working together. And I wanted to just show a few of these because, again, these models, the frameworks are often used in conjunction with each other because they do slightly different things. So PRISM really evaluates how a program or intervention interacts with recipients and the determinants of implementation. So again, the determinants are the things that will determine success or challenges. And that includes the RE-AIM outcomes. So you can see the middle blue box is the RE-AIM outcomes of the first framework I showed. Next slide. This one is called the Consolidated Framework for Implementation Science. This graphic that I'm showing you here is their determinants. So again, the things that impact successful or success or challenges when you're implementing. They have things to think through around your intervention, around outer settings is sort of the things that are outside of your organization that you might not have control over. For example, policies, laws, that sort of thing. Inner settings are the things within an organization. The process of implementation also has its own set of determinants. And in the middle, it's the individuals involved. Now, this is a lot. All of the frameworks, the diagrams have a lot of information in them, but once you select one, you can go to the website and many of them have tools that dig into each one of these characteristics. So you won't be sort of left to figure it out on your own. There are individual assessments for many of these and tools that you can use to help also like onboard yourself and onboard staff and your team members to these models. Next slide. EPIS is another framework. On the outside, where you can see the arrows go around, this is their process framework. So that's the process of implementation or their phases of implementation. That's exploration, preparation, implementation, and sustainment. And phases are sometimes helpful to identify because there are certain things that need to happen in each phase to make implementation sort of run smoothly. So there are things you would do before you implement, there are things you would do while you are implementing, for example. And inside this diagram for this model are their determinants of things that would impact success or challenges. So they have something similar to CFR. They have the outer context, so what's outside the organization. What's inside the organization, they have innovation factors and bridging factors. But this is just, again, as implementation science has evolved and people have really tried to describe some of their findings and what will be helpful in the field, these different frameworks have been published and they slightly describe things differently. But for the most part, these determinants are similar across the frameworks. Next slide. And then I wanted to acknowledge the National Implementation Research Network's frameworks. They've done a lot of work in systems of care, but I think are a really big framework used in child welfare systems. And NERN has 5 different frameworks. And the reason that I wanted to show them too is to just show you sort of to demonstrate how folks might pick 1 or 2 of these and use it in conjunction with another framework they find helpful. So for NERN, they have a framework that describes what is a usable intervention. So how do you know when an intervention or a program is ready to be implemented? They have a framework on teaming, so how to pull together a team and how to partner well with one another. They have a framework on implementation drivers. So I just mentioned that sometimes the frameworks call the same thing by different terms. These are essentially determinants. So if you look to the diagram on the slide, those are the determinants that NERN has called out specifically, things like coaching, training, selection. Those are the things that can impact the success or challenges of an implementation process. They also have a framework around implementation stages and a framework around improvement cycles, which Marlene will actually talk a little bit more about. Next slide. For more information on any of those, I included this chart so that you could get a definition of each of those frameworks if you were interested in learning more. Next slide. I think the most important thing, I ran through those pretty quickly, and that's because the goal of this was not to have you select one right now or to completely understand these frameworks, but just to see that there are a variety of them out there. The way that they describe things might be slightly different, all with a common goal of sort of giving you a roadmap to make implementation effective. And I think, you know, for me, when I'm working with folks, I think that having an implementation framework is more important than exactly which one they selected. I think the at least, you know, if you're going with, you want to go with evidence-based implementation frameworks for sure, the ones that have been tested and tried in the field and that have been created with the available evidence that has been collected. But with that in mind, having a framework is the most important thing. It really helps you to understand what are the activities that need to come first, second, third, and what are the activities that have to be infused throughout the process. And there are so many stories and examples of implementation efforts that fail, not because they weren't good ideas, but because there was no strategic process in place to do them well, to get staff onboarded, to really make sure that the model was ready to be implemented and there was infrastructure in place. And I'm sure all of you on the call today can imagine times where you've been part of implementation efforts that were frustrating because things just weren't making sense, or they were disorganized, or you didn't have enough staffing, right? So these are the pieces of these frameworks that are really helpful to just have us all sit down and just take a moment to really plan out our process. So I'm going to go through now some common elements of each of the phases and things that we look for in our own work. I'm going to use our implementation framework to describe this. We have developed our own based off of some, basically summarizing a lot of the work we've pulled from all the frameworks I've mentioned. And we wanted to create something that was user-friendly for the practitioners we work with. So this is what we've developed. And I think because we've pulled from so many frameworks, it's actually a good summary. So we have 3 phases of implementation that are part of our framework: pre-implementation, implementation, and sustainment. And in the pre-implementation phase, this is a very watered down explanation, but basically that phase is really where you explore the problem and hopefully gain a deep understanding of what you're actually looking at, and trying to address. And a lot of this is informed by the data that you have available to you, not only in numbers, but also in client experiences and feedback, right? And then from knowing the problem, you want to work with your stakeholders and community to create a plan to move forward towards the desired experience. Within this phase, there are a lot of steps that aren't mentioned here, like developing the right team and knowing the right stakeholders and what kind of infrastructure do you have in place. But essentially that phase is really about understanding what are you going to do and what are you trying to address. In the implementation phase, it's about, at this point, you know the problem, or you think you do, and you think you have a good solution, and the team agrees that you're going to move forward with something. And so as you move forward implementing, it's the phase where you are constantly testing the theory, right? Where you are assessing your work, and you're evaluating in sort of rapid improvement cycles. What's the data showing? So if you think you have a good idea and you're implementing it, you also have a method to evaluate that implementation to give you feedback. Is it working or not? If it's not working, you have to revisit the plan, right? And kind of change your methods perhaps, or change your method of evaluation. But this is sort of the tinkering phase, and you'll be tinkering pretty continuously until you start seeing your desired results and the community is getting their desired results, and you feel good about what is being measured and all of that. So in the implementation phase, it's a lot of correction as you go, but that's all good because it's all data informed decision making. So we'll talk a little bit more about that. And then at some point when you're getting the desired results and the problem is being addressed, then you would move towards sustainment, which is actually embedded throughout the whole process. But sustainment is really about continuing to implement the model, figuring out how you're going to measure it long term, how you're going to make sure that you can replicate the work and that you can scale it up and that it's going to survive things like turnover. And so that is that last part of the process, or the phases there. Next slide. On the inside of our framework, we have our determinants and the things that we care about called out specifically. So one of the things is continuous quality improvement. And so there's a lot of ways you can do your own continuous quality improvement. You can do early testing, also called pilot testing, of whatever initiative or program you're doing. You can have robust readiness practice, process, and outcome evaluations. You definitely want to track your implementation and reporting. Things like plan, do, check, or plan, do, or plan, study, act cycles are really helpful. Marlene, I think we'll talk a little bit more about this, but these are rapid cycle improvement or rapid improvement cycles that help you examine data very quickly and make changes to your implementation so that you can get the desired results. Fidelity monitoring comes into play here too. And then you're taking all of that data and you're making decisions about how you're going to support staff around coaching, ongoing training. Do you need to change anything to the model? So the continuous quality improvement is important enough to call out. On the next slide. The determinants and constructs we've already talked about a bit here, but just for example, things that can determine success or challenges would be things like policy, financing, staffing, funding. What is the internal motivation of staff to change behaviors or to implement the program? What is the population experiencing and how are they interpreting the program? There's a whole list. I think there's about 60 different kinds of determinants that you could think through depending on your project. So, but they're all the factors, right? And so that's important to examine. And then next slide. fit and feasibility is technically a determinant, but we called it out specifically because in our work, we experienced that the fit of a program or initiative, which means like how much does it align with what the community actually needs, or what will actually help with whatever problem you're trying to tackle. That is something that often doesn't get enough examination or enough support around. And so we call it out specifically. And so you want to make sure that whatever strategy you're moving towards, that it's right for the community, it's right for the problem, and that's appropriately assessed. And then what's the feasibility? So can we actually pull off what we're saying we're going to do, and can we do it long term? And the next slide should go over care pathways and interruption points. So for us, we work across systems of care. And so it's important to recognize that the people that we're helping to serve are moving through systems that are not just the programs that we're implementing. They're moving through a whole care pathway for mental health services or child welfare. And we want to make sure that we understand sort of what their experiences are as they move through that care pathway. And if there are opportunities to help them early on in that process, that we're doing that. And so this is another element of our particular framework that we lean on. Next slide. So that is just a really brief overview. Hopefully everyone can manage any feelings of being overwhelmed. I hope you're not overwhelmed. And just, I'll just leave you with, these things are overwhelming, I think, to everyone who first gets started on it. And then you partner with the right people and you land on a framework that feels good and that you understand and makes sense, and you start doing the work and something clicks, right? For everyone that I know that has done this work, it's like a clicking moment where they're like, oh, this makes sense, and it's a great way to do work. So hopefully the very quick overview of those very common frameworks wasn't overwhelming for folks. And I encourage, if any of them sort of sounded interesting to you, I encourage you to go to the links that were on those slides to explore a little more, because when you do go on those creators page, they have a lot of tools and a lot more information about each of those components that might be helpful to you. So I'm going to end there for now, and I'm going to pass it to Marlene Matarese.
Great. Thank you so much, Angela. And I'm here to talk to you about considerations for partnering with researchers. And I'm talking to you about that because typically I am the researcher that's working with provider organizations and system partners to really lead research initiatives. And we've learned a lot through that process. We've learned a lot through the quality improvement process that Angela just spoke about, and as well as some of the other work that we do. So next slide. Now, I'm not going to go too in depth about this because you are going to have a webinar that's dedicated to readiness assessment processes, but I did want to talk about it now because I think it's really important as you're thinking about engaging a research partner to determine whether or not that research partner is going to help you with your readiness assessment, or if you have the capacity to do it internally. And if you don't have the capacity to do it internally, then have that conversation with your research partner right from the start. The reason we talk about the importance of readiness is that you really want to know where is your organization right now related to culture and climate. And when we talk about culture and climate, it's those shared behavioral norms. What are those expectations within your organization? What is your employees' current well-being and their work environment? But we're also looking for whether or not you have a workforce that's ready for new innovation, right? So if you have a workforce that's burnt out and they're at a place right now to where they have innovation fatigue, to where there's been a lot put on their plates and now this is something else, you want to know that. You want to be able to have some kind of data to assess where they are so that you can address that before you start your implementation process. So hopefully you have a workforce that's ready for this. They'll be excited for new innovation. But if you don't, that's also not a reason to not move forward. It's just some additional data to determine what do you need to do to get your workforce ready before you start implementing so that they're just as excited about it as you are. The other piece is what Angela just talked about, and that's intervention fit. And to really think about, is the intervention that you've selected or the model or the evidence-based program really the best fit for your community, for your clientele, for the need that you've identified and the outcomes that you want to improve? And to really think about that and explore that. And you can explore that with the research partner as well to make sure before you start that process that you've made those considerations. And then lastly, capacity for readiness for implementation. Do you have everything that you need in place from an infrastructure perspective before you start to implement? And the reason that this matters is that the culture and climate of your organization impacts your workforce's behavior. Your workforce's behavior impacts how well implementation goes, and how well implementation goes is going to impact the outcomes that you get. So you could be implementing an evidence-based practice that has showed tremendous outcomes in a variety of different settings. But if you don't implement this in the way that you should, and using some of the implementation frameworks and determinants that Angela just talked about, you may not get the same outcomes that you've seen from other studies around the same intervention. And so it's really important to assess all of this before you get started. Next slide. So I'm not going to go too into depth about all of this, but just wanted to give you a slide and some just initial understanding over evaluation types. And again, all of this information is really to get you set up to start having these conversations with a potential research partner. So there's a variety of different evaluation types. We used a lot of these when we did our Quality Improvement Center. We do a lot of these in a variety of different settings. One of these is process evaluations. The process evaluation is assessing whether the intervention or program model is implemented as planned and whether or not the target population was reached. The outcome evaluation is doing just what it says. It determines whether and to what extent the expected changes or specific outcomes you were looking for did occur, and whether or not these changes are attributed to that specific intervention or evidence-based practice implementation. Implementation evaluation, again, it's just what it's named. How well did we do it? What did implementation look like? Did our implementation go as planned? Formative evaluation, it ensures that the intervention activity is feasible, appropriate, and acceptable before it's implemented. So it's something that you do early on in implementation, and you use those data to inform your program improvement and assessing for sustainability over time. And then the summative evaluation, and that's something that really happens at the end of the project, to where you've made all the tweaks, you've gone through PDSA cycles, you've done all of those kind of things, and you're at a place now to where you want to know, how is this going? And you're doing that when the project is stable. Next slide. So the necessary infrastructure. And I do want to point this out because I know for us, a lot of times we've engaged with provider organizations. They're like, great, go forth, do this research. And are surprised when we come back and we're like, well, we can't do this without you. So we need to have at least one person who has some, substantial time dedicated to this evaluation from you internally. We also need your time because you're the experts on your population, your organization, your community, your stakeholders. You hold all of that expertise that me as an outside researcher may not have. And so we really need to make sure that there is time from the leadership or who's ever really leading this evaluation, from the provider organization, to have time to do this, to participate in meetings and participate in conversations. To make sure that you have access to software and equipment. I can't tell you how many times that we've shared information with the site and the site was like, oh, we don't have that version of Excel. We can't even read this, or we don't have the equipment that we need to be able to do this. And that's also okay. You just want to assess early on in those conversations with your research partner of, what does this look like? What do we need to have in place before we move forward? One of the things that we always say when it comes to allocation of like that point person that we'll usually call a data manager, that there's at least 20% of their FTE dedicated to that. And again, a lot of times we'll get a little bit of pushback of, there's no way we can dedicate an entire day of someone's workload to this. But it's really important, if you want your evaluation to be successful, that you do have that point person, because that data manager is that primary point of contact for all of the activities related to the site's data collection and evaluation process. And so some of the roles that the data manager may have is coordinating all of the logistics that are associated with data collection, data management, data de-identification, data sharing with the evaluators, and what does that look like? And then also being that person who's the liaison between the researcher and the program evaluation implementation team. So it's nice from a researcher perspective to have someone who also understands research language, even if they're not super advanced in it, but has some understanding of it, to be that liaison between us and the program folks, because there's also going to be program content that they're going to understand better than we are. And so to have that point person who can liaison between the two is just really, really helpful. Next slide. So identifying a research partner. And again, these are just things to consider. One of which is looking for researchers that are interested in your population of focus. And if you don't currently have a research partner or know where to start, if you wanted to look for a university partner that's in your community, that's one first place to start. And I can tell you that on every faculty member's page, their website, they're going to have a list of the areas that they're interested in. Also just word of mouth. I think that, you might have other organizations that you're working with that have used a research partner that they've been really successful with. And, just really finding someone who's doing this because they care about the outcomes and that they want to really dig into this with you. Relationships do matter. Having an actual relationship with a research partner is significant. I'm going to talk a little bit about the why of that, because you really want to have a relationship where you can be completely transparent and honest with one another, and that there's nothing that's getting in the way of that. And if you have a good relationship with a partner already, go for it, like move into this, because building on that is only going to be helpful. Looking for someone who has legitimacy in the field and prior research experience. So I think for something like this, you definitely don't want to reach out to a researcher who this is their first time doing something like this. You want to have someone with a little bit more advanced research experience. Discussing those shared goals so that you know that as you embark on this, you're coming from the same place, looking for the same outcome. And feeling like you can ask any questions. I always hope that we create a space that's really safe for folks to push back, to ask questions, to make it meaningful. You want that same kind of relationship with any of your research partners. And making sure that your research partner has the ability and commitment to design equitable, I know you're working through the whole lifespan, but just person-centered evaluations. And I say this because I know I have certainly failed in that. And have had to be pushed because as academics, you constantly want more information. If you can get more information, you want to get that information. And as you're designing surveys and evaluations and thinking about this process, the whole time you're like, oh, it'd be so interesting to know this. It'd be so interesting to know that. But that is done on the backs of your clients, your population. And so we do not ever want to do anything to where it's actually doing harm to the folks that it's designed to benefit. And so when you have an evaluation that's going to give you a ton of information, but it takes 2 hours for a person to complete, then you're actually doing harm. You're not being helpful. And so really engaging in those and making sure that the language that's being used is appropriate, that you're not designing an evaluation from a white perspective, which is often done in academia, particularly if you have a clientele that's not white. That those are the kind of conversations you really want to talk with your research partner to make sure that they're coming at it from the same lens of, yes, let's figure this out. Let's make sure that we're getting to the place to where we can answer your research questions without being burdensome to your clients and the people that we're really trying to help. Next slide. So having expectations for the researcher, and again, this is just for you as you're embarking on this relationship to think about, like, I want to make sure that I'm getting what I need out of this, but sometimes you might not know what to ask for if you haven't asked for it before. So we know the things that are helpful for a researcher is to provide a minimum of quarterly reports. And we say quarterly because you really want to have, like Angela was talking about, like this rapid cycling of being able to get data, look at those data and decide, what are you going to do now? What kind of decisions you're going to make based on the data that you just received? If there's too long of a span between the time in which the survey is administered and you get those data in a report, you're not going to be able to make adjustments that are really meaningful. Secondly, you want to make sure your data is presented in a meaningful way. If you get a report and you don't understand anything that's in that report, then it's not helpful and it's not meaningful. If you can't take that report and go to your stakeholder and say, hey, look, here's what we found in a way that's helpful, then the report has no meaning. So really making sure, because you can present data in a variety of different ways, to be able to have that kind of conversation of what's helpful to you, what's helpful to your stakeholders, and how do you want the data presented. Engaging in dialogues about findings and implications for practice. So not just handing you a report, but really walking through it with you to say, this is what we're seeing right now. What do you think this could mean? What do you think needs to happen to make improvements in these areas that we might see that there's some shortfalls? Your researcher can certainly provide some training, and that training or guidance could be related to formulating your research question, developing your logic model, your research processes. So I mentioned before de-identified data and the role of the data manager. We always encourage our sites to share with us de-identified data. It's just an extra level of protection for your consumers. And so working with the researcher to figure out how are we going to do that? What does our process look like to de-identify the data, and how are we getting that to you? Privacy and confidentiality, research terminology, reasons for collecting specific data elements. And I say that and want to give you an example of something that we experienced where a lot of times we ask about sexual orientation and gender identity in all of our evaluations, whether it's to the workforce or to families or to young people, whoever it is, we always ask those questions. And we ask those questions in demographics because we need to understand our population. We need to know if there's an overrepresentation of this population. We need to know if their needs aren't getting met by the interventions that are being put in place. But often we'll get pushback around that, which I completely understand. For folks, it feels like it's personal. And why do we need to ask that? And so as a researcher, I need to be able to talk about, well, here's why we want to ask those questions. And that's across the board. That's just one example of it. Data-informed decision-making, practicing transparency with families about the evaluation, providing scripts to explain the intent of the evaluation. All of that really sits with the role of the researcher. Next slide. So the expectations of a research partnership, having this authentic partnership with shared goals is really important. Having transparent processes and respect for each other's distinct roles and expertise. Sam mentioned in one of the comments that, you don't need to be the experts in implementation science. You don't need to be the experts in research and evaluation and understanding methodology. But you do bring to the table your unique expertise of really understanding your organization, your population, what you're trying to achieve, all of that. And so really making sure that in this partnership, there's a respect for both of those roles, and that you have opportunities to be heard, listened to, and that, throughout the process, that you are respected for what you're bringing to the table and not feeling like you need to know everything because someone else also knows this information. Making sure that things are tailored to your agency, population, and community, making sure there's mutually understood language, which Sam also mentioned, that the whole purpose of this presentation is really to get you to a place to where you have some understanding of the language, and that when you start to work in this relationship with a research partner, that you're able to discuss, like, what are we saying here? What is the language you're using? What's the language I'm using? And making sure that you're on the same page. And at the end of the day, this is really translational research. And translational research is different than research for the sake of research. The aim of this is really to impact the populations that you're working with, to translate or to move the findings and outcomes that you see directly into practice in a much more rapid way. And so we want to make sure that there's value from a research perspective to the practitioner to improve practice, not just value to the researcher for their own academic achievement, And it's really important to know that as you embark on this partnership. Next slide. This is just a visual example of what Angela talked about, because I think sometimes it's helpful to see what do things look like visually. And so over the course of 4 years in this Quality Improvement Center, we went through a process using implementation science to evaluate and refine 15 different interventions. And we started out in the very beginning of installation, and we did usability testing. We also did readiness assessments in that initial stage. And we got to a place, and in between all of this, you can see these plan, do, study, act cycles. So as we're going through the process, we're getting more data, we're doing plan, do, study, act cycles so that we can use that data in this rapid cycling process so that we're improving practice. We're improving the way families have access to the services. We might be improving the way we're engaging families. Whatever those things are that we see from the data, we're making those improvements, and we're continually testing it throughout this process until we get to a place to where we're in full implementation and we're doing the summative and the formative evaluation. So with that, I want to move us over to hearing from Jessie. So Jessie participated in this entire process, and I will say it's just great to be here presenting with Jessie because she was a fantastic partner to work with. Not because she, did everything she was supposed to, but because there was a lot of times where Jessie would push back and say that this isn't helpful, or this needs to change, or I don't understand this. And it really helped us to form a really good relationship so that we improved. We learned how to do this better. And I think that we got to a place to where the evaluation and the work together was more helpful for her as well. So with that, I'm going to pass it over to Angela and Jessie to kind of have a conversation about your experiences.
Great, thanks, Marlene. And I'm equally excited to have you here, Jessie, and thanks for doing this. I think we just wanted to start off first hearing what your experiences were with implementation science and research partnerships prior to this particular grant.
Yes, so I work at the Ruth L. Center in Detroit, and we're a small, medium-sized nonprofit. And so before we started utilizing implementation science with Angela and Marlene, we had over the years been approached by external universities as research partners, really kind of viewing the people and families we served and our space as research subjects to be studied kind of in a way that made us feel like guinea pigs. And so we had said yes early on to some of those opportunities, but they didn't feel good for the people we served or for the people that worked at our agency. And so we had become pretty skeptical of the role and positionality of research within our direct service space. We have an integrated health and wellness center, a drop-in center, and every day there's a lot going on in our space. Over the years, part of my job has been to check mousetraps, right? Like we're pretty grassroots. And then I'm also worrying about things like auditing our individualized plans of service to check that, clinicians are appropriately documenting duration versus frequency, right? So we're doing all of these things. Everything always feels busy and on fire. And so when the idea of research came to us, we were initially really skeptical. But as Angela and Marlene said, we did eventually participate. And so I think the other thing that I like to be really transparent about it, and feels kind of vulnerable because it's being honest about a time in my life when I changed my mind about something, which is not something we often affirm in our culture, that you can change your mind about something. When we learned about implementation science, what I realized as we started to enter the experience was that it really is a culture shift, because it's an invitation to reward a culture of asking questions. And for us, that felt not just important because we have a lot of questions. As a queer agency, we've always been aware of how these systems of care that we work in don't really work for us. So we have a lot of questions about how could this change? How could this be better? And implementation science came to us not trying to view us as guinea pigs, but really engaging us as partners in a way that would shift power dynamics, invite questions that could lead to change, and really engage some of these conversations that are important to us around anti-racist social work, thinking about how we're doing things at an interpersonal level as well as a meso and macro level, and just unlocking potential and opportunity, like seeing questions as a step to potential and opportunity instead of a threat. So yeah, I can say so much about it, but I think that the initial kind of shift for me that got our buy-in was realizing that it wasn't that we were being studied, but that we were true partners in crafting the research questions. And when I say we, I mean the community we serve and the people that work at our agency. And then also that it really took what, for me at least, felt like chaos and high stakes all of the time, and gave us buckets to start to have a methodology to really prioritize and unpack and implement solutions, instead of feeling like we're kind of stuck in a loop where we see something doesn't work, but we don't know how to fix it. This was a way out of that. And I think that it doesn't fix all of your problems, but it became a place that was almost a part of our healing journey. Like now we talk about evaluation and implementation science as a way to address secondary trauma, because it gives you a framework for acknowledging some of the systemic oppression that exists in our systems of care, and thinking really carefully about solutions that are more evidence-based and have had a lot of intention and thought put behind them, right?
I appreciate that, Jesse. Thanks for saying all that. And it was really powerful too. And I'm wondering if you, is there anything else you would say maybe about the research partnerships that you felt were helpful, or maybe challenges?
Yeah, so the research partnerships that we ended up engaging in for implementation science, again, I think that I really appreciated Marlene's slide about kind of a values check and alignment, because oftentimes researchers might come from a culture of really valuing larger sample sizes or quantitative data over qualitative data. And for us, part of the challenge of how we were engaging the work was that we were working specifically with LGBTQ young people. And there are a lot of reasons that young people haven't felt safe being out in our systems of care. And so it's not that our community doesn't exist, but there weren't really large sample sizes to work with. So instead of having to work with researchers who were preoccupied by that, we really were able to find research partners because they identified as LGBTQ themselves, who were allies to the community, who understood why those numbers might be small, but that those were still really extremely relevant experiences to be documenting and learning from in our work. And so there were values questions that weren't just about what you care about, but how are you going to view research priorities and methodology within the work. And yeah, I think that also finding research partners that are excited to work with practitioners who are also learning about research in the process as well, because there's a lot of exchange. And I think that the more the practitioners can understand, to the extent they're interested, the research, that helps with buy-in when the practitioners are the ones responsible for making sure that the inputs and outputs of the research design are completed for secondary analysis. And so I think that we also had that in our research partners.
Yeah, so I'm hearing like really valuing research partners that have an understanding of whatever community you're serving as being really important there to that value sharing and alignment. Are there any other outcomes of the work that you want to touch on, or advice for others like just starting their journey?
Yes, I think, you know, the PDSA cycles were mentioned, and early on we realized that having documentation routines of the process itself was really helpful for our final implementation reports and kind of decoding what's actually feasible. Because I think for a lot of this work, especially when you're in the implementation stage and you're really focused on implementation science, it feels like it all makes sense to you. But then when you're being reminded that a huge part of implementation science is, can you hand this off to somebody else? And do they have everything they need to successfully also interpret this data or implement this intervention? That's when the rubber really hits the road. And it's great to have meaningful ideas or thoughts. But again, part of us being on the ground and the stakes feeling high every day in our work is also wanting to be invested in research that is feasible. And that's, I felt like, what made implementation science different as well. That it was really about, well, this is a great idea, but can you really do it at an average agency? Can you really translate this to another person? And so doing ongoing documentation like PDSAs helped us think about that incrementally, and then also have the information we needed in the end to go back and decide what's really worth documenting for sharing at the end of the process versus what we needed to realistically probably eliminate from our plans that was not feasible. And that's okay. I think that that is very valuable as well, like understanding quality over quantity and what you're sharing with the field so that it's accessible for agencies that, you know, don't have the latest version of Excel. Like how do we actually make this work? And so, yeah, I think that my main point of advice would be just really believing that and knowing that you have a lot to offer the field. It might not feel that way, but implementation science, I think, showed us that as well. The things that we just were doing that we took for granted, that we didn't really think a lot about, implementation science can capture in a way that turns it into learning and tools for other people.
Yeah, and I think that that sustainability piece that you were talking about is really important. And whatever, you know, process framework you all select, you know, thinking about sustainability throughout the whole process is really important to make sure that the efforts are not lost with high turnover or shifts in funding. And so what that looks like, you know, the frameworks and your research partners and others can help think through what, you know, what that would look like for your agencies. But for example, whose job description is this work going to sit in? And do you have it written down in a way that people can explain it? Is it teachable? Can I read something that tells me what you're doing and I understand it? So there's frameworks also out there that can help you determine that, or checklists, so that you don't have to hold it all. But thanks, Jesse. I think that that's all really great. And Marlene, do you have any other questions for Jesse?
No, this is really great. Thank you so much. Thanks for doing this with us.
Great. So I think we turn it back to whoever's been monitoring for questions for us.
So yeah, so we have a number of questions, and I just want to personally thank all of you for taking the time to do this. It was really accessible, and I'm really hopeful that the folks who have joined can glean some information that'll help them on this journey. I'd also like to encourage you, if you have questions right now, please drop them in the chat. I'm going to feed what has been sent to us privately, and then we've also culled what people have asked publicly. So just to start, you guys, Marlene, you commented a lot on capacity. And so the question, and it's kind of two-part, maybe even three-part, how will we know if the capacity and infrastructure is actually in place? And so Marlene, you kind of talked about it more from a data infrastructure perspective, but just curious about workforce considerations. You've talked about this a bit, but could you just be really explicit what you know, what you've seen people kind of overlook in assessing readiness for capacity?
Yeah, I mean, I think that a lot of that really, you might not know until you do a readiness assessment, right? So it's like the cycle. And I saw a comment too of, do we have any readiness assessment tools? I would say yes, there are bunches of tools out there. I always have to adapt them. Like, we have never, ever done anything to where we could just pick a tool up and use it. And the reason for that is because every intervention looks different, and there's different components to it that you need to have considerations for. And it might be in your system structures, it might be your infrastructure in your organization that you need to have in place. And so, and I also think that you're having another presentation that's focused on readiness assessments. Is that right, Michelle? Yeah, so I won't go too deep into that. But I think that engaging in those conversations with your research partner will help you to think that through. So your research partner should hold this content knowledge, right? So as you're having these conversations, they should be looking to you and saying, do you have these things in place? Here are the things that we're going to start out with, and would help you conceptualize that a little bit. So if you don't feel like you know that right now, I would say that's totally okay. I would say that most organizations probably don't walk into this knowing whether or not they have readiness or capacity until you start the process and start asking those questions. So the actual assessment is going to help you, and the conversation with your research partner and probably your stakeholders in the community, others within your organization, to really walk through Do we have someone? I'll just start with from the data management part. Do you have someone who's your point person for data liaisoning and managing those data from the provider perspective? That's one thing. And then the rest of it's probably going to come out in those conversations with your research partner in that assessment. Angela, Jesse, would you add anything to that though?
I would just add that the early phase in your implementation where you're testing things out, that's a great period, because you get to answer some of these questions if folks don't already have the answers. So you'll probably in that instance would start small, and then you would get feedback and data back to make a decision to like increase caseload or decrease for the program depending on how people are feeling, especially if it's something innovative that you're implementing. That pilot testing can be really helpful.
Yeah, and going along with that, I'm not sure what the funding structure looks like, but the practitioners who were running interventions that were being studied understood as a part of their job description that their bio documentation was essential to the success of the intervention, and that their participation in developing research questions or making edits to fidelity tools and being at meetings where those conversations were happening was a part of their job. And that was really clear from the beginning, because I think it's hard to transition someone from a really high caseload and feel like this is something that's being added onto it versus, like Angela said, decreasing the caseload and integrating this work into what they're already doing as a part of their responsibility that set us up for success.
Thank you. And Marlene is right. The next meeting that we have on May 31st is actually specifically about organizational capacity and readiness for implementation with a research partner. Angela Weeks will be one of the two presenters. And so we can ask her to pull some of this information forward. See, you've got like 5 or 10 slides all ready to go. So thank you guys. There's other questions here and Marlene, you talked about community for a minute. So people are asking, how can you just describe, and Jesse, you probably have great answers for this too, how to involve community in the process of partnering with researchers? What is your experience?
Do you want to start, Jesse? Because you're living it more than we're living it. We're just giving advice on how to do it.
Right. I mean, it has to be built into your budget is the first and most important thing that might feel obvious, but goes without saying now in our world, that if you're asking for people's time, if you're asking for their feedback, especially person served, they have to be compensated, and I think compensated well. And we have at our agency advisory board members that are involved in evaluation. So it's not just compensation for completing surveys or participating in focus groups, but engaging people in the process of confirming the validity and accessibility of a question. And I know that as a part of our project, we had support from Youth Move, a national group that also helped us think through how adultism impacts community involvement. And so depending on the community you work with, if it's people who are aging or a particular community, really thinking through power dynamics that might negatively impact or be barriers to engagement, because just because the money isn't there doesn't mean it will feel good to participate. So thinking about how to really authentically engage people from the beginning, I think is the strongest part of our work at the Referral Center.
Right.
And I would add to that a commitment to transparency. We work with a lot of sites, and when they get data reports, and those data reports don't show these amazing outcomes, they don't want to share it with their stakeholders, right? And I get it, because there's a fear when it comes to funding, or, there could be relationships that are problematic, but it's important to share the good, the bad, the ugly, that those folks who are sitting at the table are just as committed to your population as you are. And so having additional people who can help you brainstorm solutions and think through the problems is actually more helpful than just having people sit there and telling them that things are great. So really being willing to be vulnerable with your community partners and sharing the burden with them. Because you are going to have bumps along the way. You are going to get data that you don't love. And I honestly think that's great because that means you can do better, you know, and there's room for improvement, but really using your stakeholders as partners in that, I think, is important.
And I'm going to add too. I think involving your community as early in the process as possible is great. Your community is such a resource and really experts probably at whatever problem you're trying to solve, and can really help with identifying a good solution, making sure that your initiative or program is a good fit for the needs. So for example, for us, we're serving LGBTQ populations. It's very specific. We involve them from the very beginning. If you're serving a population that's a majority of one race or a majority of a certain income or whatever this situation is, like assessing that and making sure that those folks are involved as early as possible. And then I would say there's lots of tools and resources out there that will help you understand how to do that in a genuine way so that we're not tokenizing people as we're trying to involve them in the work, but we are actually genuinely partnering, and we can maybe bring those tools to a future session. And then the last thing I would say is, as you're looking for research partners, also considering the relationship they have with the community is important, and whether or not, you know, if you haven't worked with the community a great deal in this way, perhaps looking for a research partner that has some experience doing that or has someone on the team that can inform participatory research or something like that might be helpful.
So that leans into thank you guys. That leans into another question that was asked that's specific to some strategies that you would suggest if CCBHC has not been satisfied with the work of a prior research partner and before starting a new project.
I mean, so I would say I always lean towards transparency, right? So I mentioned before, like Jesse and I feel like we have love for each other. There's also moments where Jesse was not happy with the evaluation process. And I was glad to hear that, you know, maybe not terrifically glad in the moment, but at the end of the day, I was
joy.
Yeah,
there wasn't joy.
There's no joy in knowing I wasn't doing a good job. But I think like to be able to say, we are not happy with these things. This is what we'd like to see. And we'd like to see if you could change this if we move forward. If they're not able to engage in that conversation with you, if they're not able to say like, oh, that's great feedback, I'd love to improve that, then find someone else. There's a ton of researchers out there. You don't need to be locked into a relationship that you don't feel like all those things I talked about being able to be in a really respected, mutually beneficial partnership. Then find someone else would be my answer. I don't know, Jesse or Angela, if you'd have a different perspective.
I mean, I think to clarify too, we also had a lot to learn in this process and made mistakes. And I have so many memories looking back on things that I was like, I am sure that Marlene and Angela wanted to tell us not to do that, but they trusted that we needed that we understood something about our approach and let us do it. But then there was a coaching moment, there was a learning moment, right? And we were able to go back and kind of own our mistakes as well. So I think that it goes both directions, that you want researchers who are going to be engaged and invested in your growth, which doesn't mean telling you what to do. I think it's more of a coaching relationship when it comes to the evaluation and the research components. And so that, you know, I think there were mechanisms and moments where they were able to give us feedback as well, which was also the point, you know, as I saw it, the point of us participating and worked really well.
And I guess I would just offer that if you haven't worked with a particular research partner before and you don't know how you all are going to work together, it's really helpful to look at some of the frameworks and tools that exist around teaming, and how you form your early teams, and how do you make sure that your vision and your values and your goals are aligned. And that may seem like, yeah, of course we would do that. But it oftentimes it does get skipped or sort of glossed over because of the rate at which we work and how busy we are and our plates. But it is really important, and that can be if it's done early on, really helpful in addressing issues early, like if you all are not seeing eye to eye about goals, for example, or informing you that you should look for a different research partner before you engage further, or whatever, mediation. So that early teaming work is really important.
Great. Thank you, guys. So we're getting down to the end. And one of the questions was about, what if I don't understand all these implementation frameworks? Like, how, is that going to be okay? And so I'm kind of going to answer for all of you, because I feel like you've said it, right? That really your research partner needs to bring that expertise and hold your hand and coach and mentor. And then, through that relationship, you're going to decide how you're going to move forward with this particular research project, right? There was a question earlier about, does this have to be a new implementation? Could it be retrospective? And really the guidance right now from SAMHSA, if I understood this right, and Sam, you may want to come on right now, is that it could be either, right? One will probably in reality lean more towards this goal of some NIH funding for your researcher and some of those ideas, but both are very valid, both are very helpful to the field, and both can be engaged in to kind of meet this criteria or goal to inform the field more about implementation science in the context of CCBHC implementation. Do you want to add anything to that, Sam? And then I have one more question really for the group before we kind of wrap it all up. You're muted.
Sorry about that.
Okay.
You hit it right on. And, we'll triple check, of course, as always with SAMHSA, but that has been the guidance moving forward, is that it can be either or. And there's a lot of different opportunities that can be, and different routes that can be taken with this work. So I think the beauty of the CCBHC model is there's so many layers and opportunities for different types of study. And I really, really loved what you said earlier, Jessie, just around the opportunity for moving towards your own solutioning within this, right? I think about the fact that, I think it was you, Marlene, who was talking about workforce challenges and workforce burnout. And I was like, that's every single person on the line here, right? And like the reality is there's policy changes that need to happen, but it's also practice changes that need to happen. And how else are we going to learn about what those models or barriers or facilitating factors that can change and how they change are without studying ourselves, who are the ones doing the work? So.
Great. So just being forward thinking about the next thing that is going to, kind of plop into everybody's lap. It's these 15-minute calls with SAMHSA. And there was a question about what some recommendations were about what should be on the agenda. What should our folks here be thinking about in terms of those conversations? And I don't know if the presenters have an idea, but maybe Sam, you have some thoughts about what they want to, what these folks want to make sure they get to talk about with SAMHSA. Do you have any thoughts?
You're talking about this in the framing of those 15-minute touch bases?
I am, yeah.
I think SAMHSA does have a standing agenda for those, and I can also follow up on like anything needed to prep. I don't know if anyone on the line has already had those conversations and might want to share. I think there's a few layers of that, and it'll look different based on where you are in your journey. So for those of you who haven't submitted templates yet, the focus will probably be more on what can we do to help you get started in this process, to take that next step and start to even conceptualize what you might focus on, so that we can get some information out in the space that can start building a process to connect you to researchers. For those who do have templates, it's probably a look at that, and maybe some support in how you might start to shape and structure or refine your initial project template in a way that might translate it better from a research lens, so that researchers are coming to the table with a better understanding of what your early thoughts or concepts are. And for those who already have research partners, I think it's probably more along the lines of what can we do to help you move along to a process of finding funding and support.
Great. Thank you. So we're getting down to it. I want to remind you, Allison dropped the link for the evaluation. We'd love you to take a minute before you hop off and fill that evaluation out. I want to thank again this panel for taking the time to join us. We hope that you got questions answered, that we were starting to really kind of meet where you need to be to have this opportunity with researchers. Please be in touch with us if you have in between this and the next session, if you have any questions or comments. I want to remind people that May 31st at 2 p.m. Eastern time is the next session. Like I said earlier, it's specifically around organizational capacity and readiness for implementation with a research partner. You'll get to see Angela again. We'll pull in some of the information that you asked for in the presentation. And we are still looking for you guys to volunteer. We'd really like to have a CCBHC and their researcher present with the group next month about their own experience and process and how they got ready. And so if you're interested, please respond. I think Sam sent an email out a while ago, so you can either email her. You're welcome to email me. We're happy to, figure this out with you. And then, we've already talked about the 15 minutes with SAMHSA and that call. So please get those scheduled. And just a quick reminder to send any new or updated informations on the templates for inclusion, keep doing that. Earlier in this slide deck, which you will get, and we did hear that some of you didn't get the last one, so we'll make sure that's taken care of too. But when you get this earlier in the presentation, I think it was slide 5 and 6, there were some updates with some links for the database and for a new resource alert and all those things. So please use this slide deck in this presentation in between now and the next meeting to just check out the information the Technical Assistance Center is trying to feed you. So that's it. We're 2 minutes early. I think we're pretty good. I want to thank everybody again for coming. An hour and a half is a long time for you to give us, and we appreciate you doing that. So we see you in a month. Thank you, ladies.
Thanks, all.
Thank you.
Thank you for joining this month's Learning Community session. Please take a few moments to complete the evaluation for this session using the following link being posted in the chat. We hope you join us again for next month's Learning Community session.